So again, Wendy Lau Osawa is the Senior Project Manager at ITARC, the Interpretation Technical Assistance and Resource Center through the Asian Pacific Institute on Gender-Based Violence. So Wendy, we're so glad to have you, and thanks for being here.
Thanks so much. Hi, everybody. Thank you very much again for allowing us to present today on language access. This is a two-part series. So today we're really going over what is language access, working with limited English proficient individuals and some language access planning. And then next week, my colleague will be going over a bit more of the technical skills on working with interpreters, what it takes to interpret, and working with translators as well. Feel free to ask questions throughout, and we'll keep note of that. And then I'll try and give breaks to ask those questions too. And of course, we'll wrap up and there'll be more time for questions at the end. So you heard a lot of letters just now. ITARC stands for the Interpretation Technical Assistance Resource Center. We are the comprehensive technical assistance provider for Office on Violence Against Women grantees for language access. But we do serve mostly federal grantees on part of our work or potential federal grantees. So that covers a wide range. So we are part of the Asian Pacific Institute on Gender-Based Violence, and we are located in Oakland, but we have staff in Washington, California. So a few things that we do as part of our work and what we're funded to do. We provide training and technical assistance on language access planning. So if you're thinking of doing a plan or have a plan, you want someone to look over it, need some templates or resources, you can feel free to reach out to us for that. We also do training on language access for staff to get a sense of what your staff needs and doing that assessment for staff on where things are and helping out with protocols and review. My colleague does and our consultants do training for bilingual individuals who are looking to enhance their interpretation skills in office settings by providing basic interpreter skills building. In addition, we have two consultants who are certified interpreters who help train interpreters, those who are certified on interpreting for victims and survivors of domestic violence and sexual assault. In addition to that, we also provide training for law enforcement and their bilingual officers. That's also around language access planning, thinking about resource and budgeting, training their bilingual officers if they're being asked to interpret what to do, and also engagement with law enforcement, working better with communities and limited English proficient communities as well. Some policy and engagement work that we also do is really ensuring that systems are being upheld to their federal obligations by providing language access, working with courts, working with probation officers to think about how to provide language access in multilingual spaces. And Paula and I are really interested in starting the discussion around language justice and how to create multilingual spaces. So thinking beyond compliance in this way, how to really ensure that everybody is able to have use their voice in meetings or in different public spaces and really expanding on that leadership. And again, we're primarily funded on the Office Against Violence Against Women, but we do work a lot with Health and Human Services as well. So if you have any questions about this or are interested in TA or training, please feel free to reach out to us. Some other things on the forefront that we are working on right now is having a training for interpreters on working with survivors that identify as LGBTQ, in addition to training more bilingual officers and the trainers program so that law enforcement can continue to train their bilingual officers. And a toolkit for law enforcement and courts on language access planning. In addition to that, really trying to see what other issues that community and advocates are facing right now when doing language access planning. So hopefully at this webinar, you'll be able to better identify strategies to increase meaningful access through learning about promising practices, improve quality of language access provisions by understanding the role of interpreters and translators, articulate compliance measures, and how to go beyond compliance measures. We're going to focus a lot on 1 and 3 and a little bit on 2. Many of this will also be covered by Ana Paula next week. So first, I want to start off with a story from Sojung, and you can put in your responses in the chat box when you get a chance. So Sojung is an undocumented immigrant victim of domestic violence and sexual assault. Her boyfriend has severely beaten and raped her on several occasions. Sojung understands some English, but must rely on her boyfriend to communicate. Her boyfriend has told her no one will help her because she only speaks Korean. She does not know what to do. She has a neighbor that speaks Korean and English, but she is afraid to reach out and ask for help. Her neighbor stops by one day to talk after hearing the arguing and sees Sojung with a black eye. Her neighbor offers to go with her to a social service agency. Sojung and her neighbor arrive at your agency unannounced and are looking for help. So in the chat, I'd like you to answer a few questions. Do you think Sojung is considered limited English proficient? Yes or no? And then also, does Sojung resonate with other victim stories in the community that you serve? So in the chat box, if you could type yes or no.
So we're getting a lot of yeses from folks.
Okay. Great. Great. So many of you who are advocates, I'd like you to do the second poll in this scenario and answer these questions. If Sojung were to walk through your doors, what would you do in your agency? Would you look at your language access plan to see the protocol? Use a neighbor to interpret for the intake? Ask Sojung to come back another day when an interpreter is available? Or ask your supervisor what to do, or other? About 12%, 20%, okay?
So far it looks like the majority of folks are choosing looking at the language access plan to see the protocol. We have a few folks say use the neighbor to interpret for the intake, and 13%, a little bit more than the last one, ask the supervisor what to do. So,
great.
Yeah.
So that's been a minute. I'm going to close. Great, thanks. Closing the poll. And as you can see, we have different results. Some of you are going to look at your language access plan, which is great. Some of you are going to use the neighbor to interpret, and we'll talk about that in a minute. And some of you would ask your supervisor what to do. So we'll go over how a few of these options would work, the problems of some of these options, and really focusing too on why it's important to really think about having a language access plan. So providing language access, it can be a matter of life or death, as we see in these situations. Somebody is coming to seek help for assistance, escaping a scenario, and they're really ensuring a way to communicate that they can tell their detail and story. Many of you may have heard of this story, a situation that happened in New York City, where a law enforcement agency, their protocol was to have victims write their statements. An officer came to the door of an individual who was Spanish speaking and had asked them to write down their statement in Spanish. Came back to the precinct, never got translated, and unfortunately 2-3 days later, her abuser came in and she was killed because there was no translation of the story. So having language access, being sure you find out the details of what's happening, the exact details of what's going on for a victim's experience is very important in order to provide that service to them and ensuring that they're seeking help and are going to be in that safe place. Consistency is also key, so ensuring that everyone is provided interpretation. Language access is not just about who is convenient to provide interpretation for, but thinking about how you're providing language access for languages you see very often and those languages that you may not see very often too, and being sure that each individual who is considered limited English proficient is being offered the same kind of services for interpretation, translation, and really thinking about that equitable way of providing that service too. Proactive and reactive. Language access is really about being prepared. I know many of you may work in communities where you may only see 1 or 2 limited English proficient individuals in a month, or maybe every few months too. But it's about being sure when that person who's in trauma is walking through your doors, your staff, and you are prepared to serve that individual. You have the protocols in place to contact an interpreter or know what to do so that you're able to move on and help that person. Reaction is where gaps happen, where staff may not understand how to contact an interpreter, what to look for in an interpreter, and sometimes that individual who is limited English proficient may not feel that there are enough services there because there isn't that preparation too. And that comes into the really chicken or the egg approach. If you build it, they will come. Communities know which organizations have services and speak common languages and are prepared to serve individuals who speak other languages too. And they also know who not to go to. They know if an agency has turned away people in the past or they have to wait a longer period of time for an interpreter. So being prepared, letting the community know that what service you have available also ensures that trust building and allows communities to access your services in a way so they also feel safe. So this is some data that's pulled from lep.gov, and many of you may have seen this before. It gives kind of a map of where the population is on what languages they speak. I know African is not very helpful as African is not a language. There are many languages in Africa. But this kind of gives you a distribution on where some of the limited English proficient populations are. You know, even there may be concentrated in the urban areas, we know too, and I'm sure that many places are seeing an influx of limited English proficient individuals in the rural areas as well. So again, being prepared and having a good assessment about who's in your community is important to being sure you're providing the right resources and services to the community. Just some brief data here. So roughly there are 313,551 LEP residents in Colorado. Residents that speak English very well make up about 6% of the population. And there's been a huge growth in Colorado between 2000 and 216 in foreign-born LEP populations. Of course, you know, being limited English proficient sometimes has nothing to do with immigration. Many people who have lived here for a very long time could be considered limited English proficient. We're really thinking about what language they prefer to communicate in, which goes into the definitions here. Individuals who do not speak English as their primary language and a limited ability to read, write, speak, or understand English. And many of you know too that when you are in a state of trauma, sometimes it's very difficult to express yourself in a different language or one that you're not comfortable in. So one question is, even if they may have a comprehension of English, if they speak a few words too, what language is the person you're serving most comfortable in communicating in? And how are they going to express themselves and provide that detail in what language? And that will be a good sense of whether or not they will need an interpreter or you're preparing to get an interpreter for them. Right in with that, we do consider individuals who are deaf as part of the language access and limited English proficient community. As many individuals who grow up deaf, their primary language is American Sign Language. And the syntax is very different from English, and English is a different language from American Sign Language. So they are part of the limited English proficient community. This webinar in particular won't cover so much about working with individuals who are deaf and hard of hearing or sign language interpreters, but Vera Institute is a great TA provider that provides a lot of materials on working with communities who are deaf and hard of hearing and how to make your services more accessible. We'll touch on it a little bit, but if you're interested and wanting to learn more about sign language interpretation and working with deaf populations, then really we'll have a link at the end about going to Vera about their topics as well. as this webinar will be focused on spoken language. Just some clarity here, uppercase D refers to an identity with its own culture, language, and diverse communities too. And lowercase d refers to the physical condition impairment. So you may see that often, big D, little d, including hard of hearing as well. It's often understood and seen as a disability issue, but again, it is a language access issue. And so we work together a lot to ensure that organizations are being sure that they're able to provide language access to all individuals where English is not something they're comfortable in. I'm going to go into a few of the compliance issues that many of you may have already seen. Many of you who are grantees have maybe seen this language before or have seen it in your grant requirements too, as necessary to provide services. The guiding piece on language access really falls in the Title VI Civil Rights Act of 1964. And as you see here, language access isn't specified here, but it's very much tied to national origin. And this is due to a seminal case that happened in San Francisco in 1973, Lau versus Nichols, where the Supreme Court found that because a student was unable to access educational opportunities in his preferred language of Chinese, that it was a violation of the Civil Rights Act of 1964. And that's where they really tied language access rights with national origin rights. So not being able to provide language access could be considered a violation of Title VI based on national origin. And particularly too, in the case, they determined that individual agencies that receive federal financial assistance have to be sure that they are not discriminating against individuals based on national origin. So government and government-funded programs must provide meaningful access to program benefits to persons with limited English proficiency. So many of you attending are grantees, federal grantees, or sub-grantees, and because you are receiving federal funds, a requirement to provide meaningful access. So what is meaningful access? As it is not really defined in the executive or in Title VI, but it's really spelled out in the Department of Justice plan. Meaningful access is defined as language assistance that results in accurate, timely, and effective communication at no cost to the limited English individual. For LEP individuals, meaningful access denotes access that is not significantly restricted, delayed, or inferior as compared to programs or activities provided to English proficient individuals. So we're really looking at the issues of equity here, making sure that people aren't waiting an extra amount of time as opposed to English-speaking individuals, looking at how it could be inferior or delayed. So ensuring that your interpreters that you work with are skilled and trained to interpret everything accurately. The problem with maybe losing a neighbor at the time is that if they're not trained in interpretation, they may not be conveying everything to you that you need. They may summarize information, which means they're using their own discretion to tell you what's important, and that may be inaccurate and will be restricting information that is being given to you as an advocate or to an interpreter as well. Really thinking also how the language access plan, how your protocols are ensuring that individuals who are receiving your services who are limited English proficient are being able to go participate in certain activities, how they're able to access shelter and information that way as well. So in cases where people may be asked to come back another day, waiting for 3 hours for an interpreter, that could be considered significantly delayed. Of course, there are other factors to determine about resources, but really thinking how we are uplifting services that put limited English proficient individuals on the same level as English-speaking individuals. So a quick question, you can answer true or false in the chat. We have a scenario here. The sister of a victim calls a victim service provider to arrange for a meeting. She informs the provider that her sister needs an interpreter and is told they will need to try to find someone. When they arrive for their appointment, no interpreter is provided. The advocate asks the sister to interpret, and the sister explains that the agency must provide an interpreter as recipients of federal funding. The advocate explains that even though they receive federal assistance, the local English-only law means they are not required to provide language access. True or false? You can answer in the chat.
So we're getting a majority of false answers in the question box.
Great. So this is true. State and local, sorry, go ahead.
Sorry, we do have one true.
Okay, great. So the falses are right. State or local English only laws do not relieve an entity that receives federal funding from its responsibilities under federal anti-discrimination laws. Entities in states and localities with English only, that are sometimes called official English, laws are certainly not required to accept federal funding, but if they do, they have to comply with Title VI, including its prohibition against national origin discrimination by federal recipients of federal assistance. So failing to make federal assisted programs and activities accessible to individuals who are limited English proficient will in certain times violate Title VI. So even if your state has an English only, English official law, if any entity is still receiving federal funds, then they still must abide by language access and Title VI and provide meaningful access. Just quickly over the bit of the ADA that we can see here. The big difference between ADA and Title VI is that under ADA, federal funding doesn't matter. So even if you don't receive federal funding, you still have to provide public accommodations and required to provide ASL interpreters and other auxiliary aids to ensure effective communication with deaf and hard of hearing individuals. And notice that at the end, this deference must be given to deaf and hard of hearing individuals' choice of communication. So not what the organization can provide, but how that individual prefers to communicate. Whether it's an in-person American Sign Language interpreter, another type of sign language, perhaps that they grew up speaking, using British Sign Language or Mexican Sign Language, or if they are distrustful of the community's American Sign Language interpreters, given the small community, it may be that they want to use someone telephonic at that time too. So really thinking about that individual's choice. Again, most nonprofits and agencies are considered Title III entities, which are public agencies, and is required again to provide effectively. The goal is to ensure that communication with these disabilities is equally effective as communication with people without disabilities. So thinking about how to ensure that your materials, what you're using to speak, to communicate information from is equally effective. The key to that is to consider the nature, length, complexity, and context of the communication and the person's normal methods of communication. So really considering if it's a difference between a doctor's appointment, a therapy appointment, as opposed to a quick intake, those will be very different. If it's an emergency where someone's coming in to seek help at the time, that may also be very different too. So thinking of all these different factors and determining what modes of communication you will need. Again, also putting safety first and how that will affect that person's safety coming through your doors. This rule applies to individuals who are being covered and asking for services, but also someone whose person is coming in with a deaf parent, deaf spouse, or deaf companion in appropriate circumstances. So if you're going to court, for example, and the individual is coming with you and also bringing a companion or a parent, and if that parent needs other services, then an interpreter should also be provided for that parent. Depending on where they're sitting at, and also depending on if it is a meeting, if it's their opposing sides, but really thinking of providing interpreters for each individual who may identify a need for an interpreter at that time. There are 3 prongs for effective communication: communicate with, receive information from, and convey information to. And what this really means is that it's not just about one-way communication. So if you have someone comes in who's deaf and you provide a brochure to them about all their services, that's not enough. That individual has to be able to ask you questions, and you should be able to answer those questions too. So handing over a brochure is not necessarily all prongs of effective communication. You need to find a way in being sure that they're able to communicate with you in a way that they can tell everything, and you should be able to communicate with them in a way that's helpful for them. So writing back and forth may take a long time and may not be the best way, given a lot of details. So getting an interpreter is probably the best way to have that effective form of communication. Of course, it also depends to ensure that this interpreter is certified to provide accurate interpretation as well, and being able to ensure that the individual is signing properly and you're able to understand that interpreter too. So there are a lot of pieces in having effective communication, primarily because of how that interpreter is trained, and being sure that you as an agency are aware of the different kinds of communication forms that you have. Again, part of it is looking if it's in person, if it's on screen for video remote interpretation, and in cases where their emergency is writing the best way because of the time constraint and because of the safety issues that are being there. So things to think about when really planning for how to communicate for accessibility. So we have a quick pop quiz. True or false? Everyone is subject to Title VI language access requirements. I have a good feeling that many of you will get this right. And you can answer that in the chat.
So we have some trues, we have some false.
Okay.
Still coming in.
So for the
True.
okay.
Yep, we have about equal true, false.
Okay, so just to be clear, everyone is subject to Title VI language access requirements. It's false. Only if you're receiving federal funds are you subject to Title VI language access requirements. So really thinking if an entity is only receiving local funding, private funding, or state funding, they may not be subject to Title VI under the law. Should they? Ethically, yes, but there is no legal requirement for them if they are not receiving federal financial assistance to promote language access. The second question, true or false, everyone is subject to ADA accessibility requirements.
So they're still coming in, but we have a couple trues. And folks, remember to type in your answer in the chat box. So far, all of our answers are true. Yep, and they're still coming in, and it looks like it's still coming in true.
Great. Yes, so everyone is subject to ADA accessibility requirements. So there's, regardless if you receive federal financial assistance, regardless of everything, everyone is subject to the ADA accessibility requirements and ensuring that effective communication is there. So those are really the two big differences. Legally, in terms of providing language access, again, summarize, Title VI is really defined as providing meaningful access, and that really is important for those of you who receive federal financial assistance, and most entities do receive federal financial assistance. Courts always receive it through Department of Justice for their services. Law enforcement, if they have bulletproof vests, it means that they got money from Department of Justice to get that, so they have federal financial assistance, so they should also be providing meaningful access. And again, for under the ADA, it doesn't matter. If you don't have federal funds, you should be providing accessibility requirements too. And of course, this includes not just deaf and hard of hearing, but there's also other accessibility requirements too. And again, we have the link for Vera on the resources page to really help as you're planning for accessibility. I want to take this time to pause for any questions regarding anything of the legal compliance issues before we move forward. So we'll take a few minutes and you can type your questions below in the chat if you'd like.
So far, no questions have come in as you've been chatting, and currently there aren't any questions coming in right now, but feel free to type in your questions into the chat box and we'll be happy to read those out and get those answered for you at this time.
Great. So we'll move right along. We're really thinking about language access as being an integral part of organizations and not just an afterthought and not just something ancillary. So we hear that groups don't have enough funds for interpreters, but it is about planning and it is about budgeting, but also thinking about what your mission says. Many of you come from organizations who have a strong dedication to serving victims and survivors in your community and county too, and all victims and survivors. It's not just about who's convenient, about language provision, but thinking about how you're really serving everybody in that area, even those individuals who require language access assistance as well. Budgeting and planning and developing relationships will help plan for interpreters and help your funding too. They'll also improve communication to obtain important information and supports victims and survivors seeking assistance and validates help seeking. As you know, many individuals who are coming in have been told often that no one will help them, just as we saw with Sujung. And when they're turned away because there's no interpreter, it reinforces what many of their abusers have told them before. So as we go into budgeting more later, we'll think about how you really plan about budget for a line item, including your narrative, and really thinking about how you're ensuring that every single one of your grants too is really committed and talking about your language access work too, so that every program that you have has a piece of language access, ensuring that you're going to be able to serve the entire community and planning for that. And language access is a process. It doesn't happen overnight. It's a journey, as we call it many times. You start from the beginning, you start from the basic, the floor, and you move towards the ceiling, and maybe even beyond too. It's an evolving process. This happens, you start with a plan, you start with interpreters, and you continuously move forward too. We've worked with entities many times who have been doing language access for 10 years, and they still find ways to constantly improve, better ways to reach out to people. I work with the court coordinator in Seattle, and she's always finding new interpreters to bring on her roster for different languages too. Trying also to figure out how she can budget for flights from American Samoa to get the right interpreter in some of these hearings too. So these are the things that you start from the basics and you move forward. It doesn't happen overnight, and no one expects all change to happen overnight too. But as you plan to integrate language access too, getting staff buy-in, getting management buy-in, thinking about funding too, all these pieces come together to make sure that that communities are going to be better served because of your language access process. These are some things that we just call the floor of compliance measures, just basic things that every organization should have and that meets minimum compliance measures. So compliance we really think about as the floor, just to make sure that you're not under the DOJ radar. But we want to really aim more than that because we're really thinking again about equity and making sure that individuals who are accessing services can experience things the same way as English-speaking individuals. And some of the things on the floor, though, are signs indicating free interpretation for walk-ins in multiple languages, ensuring that individuals don't have a fear for asking for interpretation because of cost. Many people don't ask or request for interpreters because they don't think they don't want to pay for extra interpretation too. But letting them know that there is free interpretation available, they don't have to bring their friend or relative, and that they're able to get a free interpreter. Acknowledging and letting limited English proficient knows they're entitled to at no cost. In person, if you don't already have signs, providing a qualified interpreter or bilingual staff to communicate. Qualified interpreter, meaning somebody who is trained in interpretation, someone who's gone through either a 40-hour training or going through a test. Being bilingual is not enough to interpret. Just because someone's bilingual doesn't mean that they have the skills or know the ethics. I think you'll learn next week, but I think there's about 58 cognitive skills necessary to interpret. So it goes beyond being bilingual. Or you have bilingual staff that's able to communicate with them in their own language, and you're not relying on an interpreter. And that's fine. not using children, family members, or friends except in exigent circumstances. We talked before about maybe the neighbor of So-young not having the right kind of qualifications, but also thinking about bias too, whether or not that neighbor may have bias towards some things. Maybe So-young, of course, may not feel comfortable expressing some ideas about what happened to her because of their neighbors. Of course, we know too that using children can be very traumatic, which is why we don't use them for interpreters. And as we say, as it says here, unless there's exigent circumstances. So if there's a medical emergency, if there's danger, then it's okay to make sure that everyone's safe. But when that exigency has passed, making sure that you're bringing on an interpreter to continue the rest of the conversation. I speak cards to identify language. Sometimes community organizations give out I speak cards to individuals who have these cards that say, you know, I speak Chinese, and they can hand them over to services. Another way is to have organizations have a language identification card so that individuals can point to what language they speak to. Many of you may have contracts with telephonic interpretation companies, Language Line being the largest. They may provide you an I speak card with a long list of languages people can point to. Or if you're looking for other templates, we can also send that to you too. Georgia has a great flip book with different languages. I know Kentucky created another point language card too that's a little bit more colorful and much larger font too. So there are different ways you can also create your own to make sure that you're capturing the right languages in your community. Being sure too that not everybody who comes through your doors is able to read or write, so you may have to start differently. Maybe you start with a world map so they can point to a place as a start on researching what language they speak to. And a language access plan and protocol. It was great to see that many of you in the poll would go to your language access plan and protocol and have seen it and looked through it too. It's a great way for staff and organizations to go through what is needed to provide language access, but also it shows to your funders and to the Department of Justice that you're committed to providing language access and that you have that plan and protocol in place. So before moving on to a little bit language access planning, and we have scenario 2. An agency is on a citywide contract to use Language Line to speak with limited English individuals. Only managers are given the number and access code to Language Line. Occasionally, Language Line will come and give a training on how to work with telephonic interpreters. On July 18th, a Mongolian speaker, Mr. M, comes to the agency seeking assistance from Miss E. Upon approaching Mrs. E's desk, Mr. M points to Mongolian on the I speak card on the desk. She tries to reach her manager, and her manager cannot be reached. She writes on a piece of paper, July 19th, come back at 3:30 p.m. and gestures her hand towards the door. In the chat box, I'd like you to consider the next 2 questions. How can this agency become compliant, and how can it improve? So whether this agency is compliant, and if it's not, how can it improve on its compliance? So take some time for you to write that in the chat box.
So Wendy, there's a question about English only laws. Would now be time to do that while people type in?
Sure, we can go ahead and answer that question.
Yeah, so folks just want to know if you could explain a little bit more about those English only laws that some states have.
Sure. So some states have voted into legislation that official English or English only is necessary. Most of it is due that it's the business conducted by the state. So if there's a state hearing, it'll be in English. But some other entities have interpreted that to mean that everyone must speak English to access their services. And we know the second part is not true. It is the intent for many of these English official, English only laws was primarily for state agencies to conduct business, or at the capital or each state to conduct business in English. But unfortunately, the interpretation of it spread. And as many of you may know, some agencies have used that to restrict access to services or turn away people because people don't speak English too. So you'll find that some state agencies have interpreted it to be, well, instead of thinking about language access, their fallback will be, well, because we have an English only law, they're supposed to speak English and learn English, that means we don't have to help them. So this latter part, that's not true at all. But we bring that up because some states, and I think Colorado has actually an official English that was passed in 1989. That is a state law too. We've heard, and given the climate too, that we've heard that sometimes it has been interpreted to be very restrictive on people who are looking to seek services from agencies. Does that answer your question?
I think so. Yes, thank you.
Okay.
And then so far, the folks that have answered have either said giving more access, more staff access to the line, or making sure that everyone has access to the line.
Great. So we see here again that we talk about meaningful access, and coming back a day later for services would definitely be delayed access to services. So this could be possibly considered a violation of Title VI and not provide meaningful access. And you're right, when a manager has one control of the line or one control of what to do, when they're not there, that means no one else knows what can happen to. So being sure that staff is able to access the language line, but then also staff have a protocol or manual they can pull out to know what happens when somebody who speaks Mongolian or someone who's limited English proficient comes seeks their services too. So one thing is, yes, definitely have the access code and language line available to everyone. Two, making sure that that information is readily available to individuals, whether it's on the computer, whether it's in a plan or in a handbook manual, so that people aren't looking for it or last minute having people wait too. Great. So a language access plan is a strategy to assess, identify, and manage a system to ensure that limited English proficients are able to access services. And many of you may already have this as well. And you can feel free to share too what worked best for you in going through this language access plan if you would like. One thing that people plan for language access and what's very different depending on where you are located are these 4-factor analysis for meaningful access. So people may ask, well, I live in a pretty rural area, not a lot of resources. Am I expected to provide language access for everybody who may come through my door? That's a lot of language, is expensive. It's not the same as being in an urban population like Denver, where there's a lot of resources. What are the differences, and how do I ensure that I'm providing meaningful access given the different resources or different populations? So it's really going through this analysis of assessing these 4s, looking at the number proportion of LEP individuals served or encountered in your community or in the LEP population. So individuals, not just who are coming through your door, but who potentially may be coming through your door. And your population may be different depending on your grant and your agency. You may be serving a community, you may be serving a city, or the entire state too. So looking at that, assessing the population and who is eligible, what community may be eligible of going through your services. The second is the frequency of interaction. And how often does somebody who is LEP come through your doors? Is it every other day, week, monthly, yearly? That'll determine and help determine, are you looking at on what services you can provide and how. So maybe if they're frequent, you would want to think about hiring bilingual staff. If it's every once in a while, it's really thinking about what interpretation, telephonic interpretation or video remote interpretation works well for you. And also depending on the language as well. The nature and importance of the program, activity, or service provided by the program. If you're the only service provider in your area or in your population, there's going to be an importance for you to provide language access at the time, because everyone will be coming to seek your services. As compared to a place where there may be multiple agencies providing services for sexual assault, there will not be so much as an impetus to provide language access, even though you're still required under federal obligations. But those are the differences too, and how to plan for that. Also, the difference is also on your program or activity in your program. If you are a service provider that has a hotline and that's your main way that you communicate with the community, it's really important to provide language access to the community. But if you also provide a knitting course to help with therapy, maybe something that is not as important, and you may not have to plan so much for language access at that point. So really thinking about what are the programs that are important to access the community and where you're located and what other options that other people may have to access your services is a necessary factor too, and planning for tools to provide for language access. And resources available to the recipient. So federal government does look at what resources are available. Even though many of you who are grantees know that the funds you have provided, you're supposed to use that for language access, they are obviously aware that if you're getting other funds or restricted funds, if you're having to manage different things because of language access, they will take that consideration as well. So going over these 4 points, it's important to plan for language access on whether you hire interpreters, whether you hire bilingual staff, how you're preparing to interact with individuals limited English proficient, and what programs are you going to have to focus on to support language access too. And this is, again, different for urban populations and rural populations too. These are all the components of a great language access plan: by identification and assessment of LEP communities, making sure that you're assessing your service area, city or county or state, collaboration with LEP communities and other stakeholders, getting feedback with other service agencies and communities on how your services are. Description of timeframes, objectives, and benchmarks. As I said, language access is a journey. No one expects agencies to get things overnight, but setting goals, so when you're going to get things translated in different languages, when you want to plan for hiring a bilingual staff advocate, when you're going to bring on interpreters, when training is going to happen for staff. All of these are timeframes and benchmarks too that can be put in your language access plan. Identifications of persons who will implement the plan. Persons being plural, it does take more than one person to work on language access. And it shouldn't always fall on somebody who's bilingual or multilingual. Language access is a priority of everybody in the staff too, even if they're monolingual too, because they will be serving LEP individuals too. So what's a good team to put together who's going to help implement the plan, help plan for training, maybe also take complaints if they hear things are happening with certain interpreter or interpretation agencies, getting feedback from staff on how it's working. A plan is successful when staff like it and it makes their life more efficient and works. And these take time to realize too, because at some points staff will not think a certain vendor is great, or they may not think a certain protocol works out best for them too. So being sure that feedback is being changed. Identification of funding and procurement strategies. This is, again, really important that many of you who work with and write grants and work with team and to write those grants too, that not only are you writing in your narrative about providing language access, but also really thinking and working with your budget manager on how much you need to allocate in your line item too on budgeting for language access. That includes if you're budgeting for interpreters, if you're working with a culture-specific agency to provide interpretation, how much is that going to cost you as well? And looking at that balance. As someone who reviews grants often, it's important that I see that it's both in the narrative and in the budget too, and that commitment is there. Training on policies and procedures. The plan is very important, but context is also important too. So being sure you're training your staff on working with interpreters, what the language access plan is, and who's in your community too, and also thinking about outreach strategies. Outreach to notify survivors of language access assistance services. So are you getting those forms translated? And if you are, will you have interpretation to back that up if people come seek your services? And management creating and policies, plan, and procedures. Many of you may have plans that are out of date. The technology is not the same as it used to. You change vendors, interpreters that you have moved away. So these things need to be updated over time, which makes it, again, why language access is a journey and a process and something that doesn't happen overnight. This is just an example of a language access policy that really ties to timely, meaningful access and really committing an organization to having better language access in their plan too. We talk about this policy is really setting forth the standards and goals and expectations that we usually have on one of the first 2 pages of the language access plan. You can tie this to your mission and how it's important to be sure that the organization has adopted and embodied language access to ensure better services as well. These are just some sample protocols that we've provided, that I've talked a little bit about, and that some individuals have used for identifying language. So protocols are very helpful for all staff, from not just advocates, but people who are doing front of line work, from like receptionist work, the therapist that comes in too. So they might have different protocols depending on the role that they play too. So it's important to ask them what their access points are, how they plan for things, and seeing how language access weaves into that too. So for language identification card or world map might be really important for someone working at the front desk that sees people walking in. They may need to have that at their disposal at all times. Being sure to call a telephonic interpretation agency to identify language. Sometimes if you have a contract, you can call the telephonic interpretation agency so that they can identify over the phone. Asking open-ended questions to the individual to gauge their understanding. So this could be a protocol for everyone that's working with somebody. Again, not everyone's gonna identify themselves as limited English proficient or ask for an interpreter too. They may not know it's an option. So they may, you may be having a conversation with somebody and they reply yes or no, or nod their head or shake their head. And they may not really understand what is being said. So it's good to gauge by asking open-ended questions. Why are you here today? So they're able to express themselves, and then you get a sense of what's happening. An interpreter needed is both parties to communicate. It's not just for the limited English proficient individual, but somebody who's unable to communicate in their language too. That interpreter is that conduit, meaning for that information being said. So if you know somebody is not requesting an interpreter and you're getting the sense from the open-ended questions that this person may not understand what you're saying and may have difficulty communicating with English, instead of saying, do you need an interpreter? Maybe it's, me as an advocate, I need the interpreter to communicate, putting on yourself. So I need the interpreter to communicate with you because I need to make sure that I'm getting things accurately too. It's not just on the limited English proficient individual who needs the interpreter. Sometimes the monolingual person also needs the interpreter as well, so both parties can communicate. So thinking about putting it on yourself when requesting for an interpreter. Every language access plan, again, the floor of every language access plan has a policy, federal and local language access statutes, Title VI, American Disabilities Act. Sometimes they have grant language on there, definitions. So being very clear what a translator and interpreter are, they are different. Interpretation is the oral transmission of language, and translation is the written communication. Again, interpretation is the oral transmission, translation is the written transmission. And being sure that your staff is aware of both those differences. You don't want to request a translator to come in when you need someone actually to interpret. Definitions on bilingual staff, definitions on what qualified or certified means, those can really help to make sure that people are finding the right people to ensure that there's accurate interpretation being done. Identifying LEP and protocols for identifying languages, as we saw in the sample protocols, how to access interpretation services, so step by step on how to call somebody for interpreter services, who they should go to first. If someone walks through their door, should they go to a bilingual staff person? Should they call the interpreter first? Or should they call another agency? So being sure that's laid out clearly for individuals to read. How to provide notice. Are you putting up signs in your entryway or in offices elsewhere? Maybe it's also tying it to your outreach to how you're providing notice. How staff will be trained is another great piece to add in your language access plan. Is it yearly when new staff come in? Is there training through reading the manual or another staff going to train them? So really specifying when someone's going to get their language access training. And how often that's going to be. It could be too that you also plan for additional training for your staff. For example, working with interpreters may be a segment you want to plan for. Telephonic interpretation may be a segment you want to plan for. So all these pieces being laid out in your language access plan as objectives and benchmarks. Very clearly prohibiting children and family members as interpreters except for exigent circumstances. So putting that in bold letters in your language access plan to ensure that does not happen. And monitoring. So when every language access plan will be updated, maybe you're aiming for every year, every 2 years, but being clear on that as well. So talking a little bit about assessment, Identifying the number of portion of individuals with your LEP eligible to be served or likely encountered by your program. Who are the people who live in the community that you serve? And there are a number of ways to find that. Many of you may already have a great sense through your intake. You're capturing that language there, of who's coming through your doors. Another way to think about it is looking through different data. So we showed lep.gov earlier, the civil rights map, and that's a great tool that breaks down by county as well by state. I also think it may do by judicial district, but it depends on which judicial district it is. It does pull from the American Community Survey, so it is a few years. I believe the last one that was updated was 2015 for Colorado, 2016. So it is a few years late. But I think visually this LEP map is great. Again, we did see some problems with how it defines language. The other one that's more Colorado specific is the one by the Immigration Policy Institute fact sheet. And this really pulls data from schools of who's learning English in the schools. And that will also give you a good sense of languages in your community. When I was working in DC, we found from the community data that Mongolian was the third largest spoken language in schools, and we would have never found that if we had looked in census data or anything. But we knew through school data that there were a lot of kids who spoke Mongolian at home, and then we did end up finding a Mongolian interpreter, and we did end up seeing a lot more Mongolian clients too. And luckily we were prepared looking at that different kind of data. I would search just this title, the English Learner Demographics and Outcomes Data Accountability piece that comes up, and it should be a PDF that's really easy to find. Below, there's just some more census data that you can look at from HHS and the census.gov that will provide other details on what the LEP population is in your area, maybe not broken down by language, but at least the populations that speak English well, not so well, and are not comfortable in English. So there are some designations there. So now that you know what languages are spoken in your community, how will you provide language accessible services? These are some options. Bilingual staff are great. Being sure too that they are also supported though in their work. That again, just because someone's bilingual doesn't necessarily mean that they can interpret. And being sure too that your policies support them if they're being asked to interpret outside. We see very often that bilingual staff are accompanying clients to court and law enforcement areas or other meetings, and then court and law enforcement staff ask the bilingual staff to interpret. Number one, a bilingual staff may not feel that they're competent enough to interpret. Number two, both law enforcement courts may also have federal funds that require them to provide language access, and requiring staff to provide that language access means that they're relying on your services and burdening advocacy services for that. One solution we have is making sure the bilingual staff can have that discretion on whether or not they can interpret or not. So in your policies and protocols, letting bilingual staff know that if you feel uncomfortable interpreting or you don't think it's necessary, that you can say, I'm not comfortable with interpreting here. My organizational policy, supports me. I'm not supposed to interpret. So they can ensure that law enforcement and courts can find their own resources for interpretation. That being said too, there are many times in emerging situations where bilingual staff will need to interpret for the safety or think about their safety for the client. Again, there are pros and cons of doing that too. We want to definitely avoid any sort of courts requesting a bilingual staff person to interpret during a hearing, for example. That will be very difficult and confusing for victims. And there's also confidentiality issues and privilege issues that do come up there too. And I think Anna Paul will discuss that more about working with bilingual staff and when they become interpreters. We also have a chart in our technical assistance manual that lays out when it may be appropriate for bilingual staff to interpret and things to consider too. In-person interpretation, anyone I think will tell you that in-person interpretation is very much preferred for services when dealing with persons with trauma too. But we know that that's not always going to be practical. And for many languages, it may not be possible to do that. But the backup is always telephonic interpretation. And there are a few vendors out there that assess their interpreters. I would be cautioned when people say that they provide certified interpreters, because certification means that they've done their own test for certification, not that they've passed an American Translator Association certification or court certification. So please ask when you're developing that contract about what exactly does that certification mean when you work with telephonic interpretation. Very common now is video remote interpretation. I know LanguageLine has this now, using iPads or smartphones to see the screen for interpretation that way. And so they're using someone face-to-face. It's some problems we've heard about that is that not everybody is working in an office. So there was an instance with one of the offices I worked with that they used video remote interpretation, and they could see someone's dog in the background barking, which is very distracting at the time. And then definitely for individuals who sign language, if you're using a smartphone, that screen is very small to see when signing. So being sure that maybe an in-person is better, because that screen is so small that people have difficulty looking at it. Volunteer interpreters and advocates. What's worked in some areas is building their own interpreter bank where they screen for interpreters and train their own interpreters to become volunteer interpreters for that agency. So they trust them, they've gone through DV training, they've gone through interpreter training, and those interpreters are just there to help out with intake, with basic conversations, to help out if they need to plan or schedule a call with somebody. So assigning those tasks to individuals too, that can be an option if you live in an area where there may be interpreters or volunteer bilingual individuals who are willing to learn about interpretation and help out with those kind of tasks. Partnering with culture-specific service agencies, it really depends on what kind of memorandum of understanding and partnership that is. You want to make sure that it's mutually beneficial too, that it's not just relying on their staff to interpret for you or serve them, but being sure that either they're provided some kind of stipend or some kind of fee when they are being asked to interpret. So thinking about what partnership looks like, that's both mutually beneficial for both the culture-specific service agency and yourself too. I've seen great partnerships where there's like a monthly, like a fee for those bilingual staff who are asked to interpret that are being trained over the phone. But a lot of this can be cleared up and should be specified too for any arrangement that you have. Translation. Another things you want to think about is how will you provide translated brochures? So are you going to have interpretation support translated brochures? And what forms will be useful for your staff to support equitable access? So one example I always give is that an organization can ask for a lot of translated forms. How are they going to be used? When someone walks through your doors and you're filling out the intake, you're walking them through each question, you're walking through the safety planning, and you're building that trust. That's such a meaningful and important experience. It's very different if you just hand somebody a form in their language and ask them to fill it out. That's not exactly the most equitable experience for people. So how are these forms being used? Is someone going to be able to walk somebody through that form in a different language too, to ensure that victim and survivor is having the same experience as somebody who's English speaking walking through your doors too? So thinking about that. It may be that if it's not, maybe it really is getting an interpreter on the phone and going through the questions so that you're able to walk them through and provide that advice instead of giving them a pen and asking them to fill it out on their own. Some budgeting thoughts to think about, and this was done through Alice Sikora from the Vera Institute. We put together a translating justice curriculum, so she's able to put this together. These are some estimates, and it does depend on what region you're in, primarily for events. So if you're planning an event with groups, like outreach event, community hearing, community meeting of some sort, these are some things to consider. 35 to 75, depending on the language being used. It can be very high for some languages. Two-person teams are larger. If it's going for more than an hour, be very cognizant that people who interpret it'll be very difficult for them to continue to interpretation. So you want to make sure that there's two people to piggyback. You'll learn about modes next week, but it's important to think about how tiring it is for many individuals to interpret. So having two-person teams they can switch off will help ensure that interpretation keeps being fresh. There are usually minimum hourly requirements and portal rates. So a portal rate is paying for how far they have to drive to get to a location. Many of you may take this into consideration if you're asking for someone to drive from the city to your organization, if you're paying for mileage, or if there's another rate involved in that too. Another thing you want to consider is headphones and headsets. A lot of interpreters will have their own headsets and have a charge for that, depending on how many people you need, but this will help with simultaneous interpretation. Text-to-speech, the text services are for individuals who are deaf, and you are doing a presentation, and there's a screen, and the words and the speech comes to the text at the bottom of the screen too. So that's an option if you're working with a group that's deaf or hard of hearing for an event. For services, very similar with estimates, again, depending on where you're at. Two-person teams, if you are doing a session, a longer session, a therapy session, maybe you want two people for 2 hours or 3 hours. Again, it really depends on the nature too. Many individuals have built relationships, not individuals, excuse me. Many organizations have built relationships with interpreters they know that are good for trauma-informed interpreting. So maybe there's one person who needs breaks, but they're really good for a long amount of time. And being sure too that the person you're serving is comfortable with having multiple people in the room too. It may be that they are not comfortable with having people in the room and just want one person there. This is a concern for communities that are very small and that linguistically, there's just not a lot of options for interpreters too. So it's a fear of confidentiality and being sure that their information is not in the community. So limiting the amount of interface that they interact with interpreters. Interpreters are sometimes also seen as great people in the community and have a lot of power too. And their influence too can shape how many individuals who are victim survivors, how they interface with that individual. Minimum hourly requirements, similar. Some of them require 2-hour minimums, and some also require a plural rate too if they're driving a while. If you have never planned for language access in your service before, here are just some points to think about and consider while you assess. So looking over the last 2-3 years, how many clients hours came to seek your services and that needed interpretation. If there's no history, think about maybe 50 hours of service for that year. And if there's some history, increase that number by 10%. You should analyze the local population, as we said, and later years increase provision by 10% based on actual provision in current year, and ensure that there's a consistent tracking of services. So if you have a box on your intake form, that really helps. Incorporating, again, language access into all budgets and narratives for grants. So some ways to think about budgeting. If you already have budgets, that's great, and you're including that. Of course, it may be more depending on where you're located at. These are just some guiding things to get started. Any questions at this time? We're about 11:11. There's a few more things to cover, but want to make sure that we answer any questions that have come up while we've talked about language access planning.
Yeah, there's one question that came in asking about if there are any known funding sources for interpretation services.
So it cut a bit, so repeat the question. If there's any funding services for interpretation, is that the question?
Yeah, if there are any known funding sources when writing grants, are there any specific ones that that cover interpretation services?
So what I have heard from program officers from the federal government, from both OVW and Health and Human Services, and partly from OVC too, is that the money that they are giving you is supposed to cover that interpretation services. However, it's being sure again that you're able to provide a clear and representation who's in your community and being able to budget for that. Many of you who have written grants, and if you haven't, looking at the solicitation, there's a very clear piece where they want to know who's in your population too. So what languages are being spoken, the communities that you may have to serve, the demographics of your community too. So ensuring that and being as specific as possible, and then in your budget reflecting that too. So because of all these different populations, this is why we need an interpreter for Spanish, interpreter for Ilocano, interpreter for Somali too, based on the population. And I have known some program officers do adjust based on that amount when they're providing the grant funds to you. At this time, there are no specific funds for interpretation. One thing that I know Google has done is that they've tried to work with agencies and helping them promote Google Translate, which we'll talk about in a minute. But those are some of the guidance I give when people ask about specific funding too. Right now, there's just not a particular private foundation or government that does just for interpretation. Okay, I'm reading the clarification. So the feds, when you receive grant money from the feds, the money that's included in your award, part of that from the award is supposed to serve limited English proficient populations too. So I would go over your award documents and I would look over the piece, and the part of it will probably say that when receiving these awards, an individual cannot violate Title VI or the ADA in that sense. And part of that is indicate that with that money and through the subgrantee money too, you're supposed to ensure that you're providing language access too. So that money has already been given as part of the award package if you're receiving money from the federal government or for federal grantees. Remember too that for ADA, there should be a different mode of planning because it doesn't matter if you get federal funding or not. This is again planning and preparing to serve limited English proficient populations with the money that you have, and thinking about again those 4 factors: who is in your population, how are you going to provide it, and planning for that too. It may be very different if you're not seeing limited English proficient populations as often, as opposed to organizations who are seeing many individuals with limited English proficiency. Great, thanks. Okay. So a note on translation too that we will go over. The DOJ recipient, if you receive money from the Department of Justice, provides written translation of vital documents for each eligible limited English proficient language group that consists 5% or 1,000, whichever is less, of the population of persons eligible to be served or likely affected or encountered. So if you are doing written translation of vital documents, being sure to see who is in your eligible service population and what languages. If there's a population of 1,000 or 5%, whichever is less, then those need to be translated. It can also be provided orally. So, for example, you have a manual that's very long, but your population is about that 5% level. You can also, if it's cheaper to get them translated, you can do that, or you can ensure that that manual, every time that person comes in, you're able to get an interpreter to read through that orally too. There are fewer than 50 persons in a language group that reaches the 5% trigger. A recipient does not translate vital written materials, but provides written notice in the primary language of the LEP language group of the right to receive competent oral interpretation services. You may have seen this in many government documents that not everything is being translated, but there's something on the back that says that if you need translation or oral interpretation of it, it can be provided. What I recommend and what I also see is that if you're going to have, if you're less than that 50 persons in that trigger, then in the back that you say in that language, in Chinese or in Spanish or in Somali, that request an interpreter for this material, or this can be requested in this language if you call this number too. It's very difficult if you have it in English, because people again aren't going to know that there are other languages available of that material too. So these are some things to keep in mind. A vital document is something that is considered information critical for obtaining federal services or benefits. So emergency plan, notices of rights, job license test, it's not everything that you have, but really a way to see how they can access those services too. So it may be, if it's a brochure that talks about your hotline or an advertisement about your hotline number, that may be something that could be considered a valid document. You should be considered getting translated. Translator best practices. Again, translators and interpreters are trained differently. A certified translator is going to go through a different training. They should take the first look of anything that you're getting translated. Then they should get translated back into English to make sure it makes sense. The third step is when you get that back, it'd be great if someone else from your community could review that to make sure there's a community responsive to terms. When we were doing some translation before, for example, there is an English difference between strangle and choke too. But many individuals, we're translating into Spanish. There was not so much a familiarity with the term strangle as there was to choke. So they use the Spanish equivalent to choke because that was something that's more familiar to the community that was being served. This happens also in Chinese. For example, there's two different kinds of Chinese, simplified and traditional too. If your population does not know how to read traditional Chinese, you want to make sure that they can get the simplified version too. So being sure your community is able to read the materials based on the language, the terminology, the format, and everything as well. And so follow up with interpretation services of translating brochures, as we said, and utility considerations. Again, how is the form going to be used, and making sure that there's an equitable way of serving someone who's limited English proficient and English speaking. Not all translators are equal. They are trained in different writing styles, backgrounds, and experiences. More experience means that they may be more expensive. It can get back to you in less time. Less experience may mean that they're less expensive, but there's more time editing and proofreading. So if you have a very short timeline, it may be that you're paying a lot. And then if you have a longer timeline, you may be able to get someone who's less experienced, less expensive, and have more time editing and proofing too. One thing, again, someone who's bilingual may not also know how to translate, write things too, so being sure you're not asking for that. And some charge on the source or target word count. So looking at either what is the source document's word count, or they'll look at what target language document, the word count there too. So it'll differ. You want to look at that. Sometimes there will be more words in the target language in the source document, or sometimes the other way around, but being sure how they're doing the word count too. It also depends. Sometimes depending on the document, and maybe they have a quote for every 50 words, every 10 words. So each translator will have a different way of providing that cost. I'm going to leave this for you to read for Google Translate, the quality versus quantity. You know, Google Translate technology has been has advanced quite a bit, but it's still not the best thing to use because of the errors that commonly happen with Google Translate. Google Translate does not take into context what's going to happen, and it's depending on, it can be changed often as well too. In this example, we see that Galician town was having a festival for their leek, a green vegetable, and by using Google Translate, they translated the Galician word grillo in Castilian Spanish. And instead of the grillo leek, it invited people to attend a clitoris festival instead of the leek festival. This was an article that happened in The Guardian, and The Guardian reported that it was the most highly attended festival in years, and they were very confused. So these are some of the issues of Google Translate not having proper translation. There was a time, I believe, where Chechnya into Russian, where Russia was translated into Mordor. So it publicly can be changed too. So beware of those things when using Google Translate. I have heard in emergency situations in shelters that they've used Google Translate for yes or no, and they've followed up with an interpreter as soon as they could too. So if there's something that's an emergency, be sure it's just quick, and they can follow up with an interpreter and let them know that an interpreter is on their way. It's an in-depth discussion. Finally, a few things. So thinking about how to implement your plan throughout the organization, whether it's job descriptions or in the employee handbook. Thinking who can advocate for management organizational buy-in. It really takes everybody on staff to commit to language access. When one person is not able to do that, that's where gaps happen. And that's where individuals cannot be served. We talked about staff position for responsibilities and definitions, and thinking about what other policies you need to establish. So maybe it's establishing a stipend for bilingual staff, looking at if you have to deal with any union issues, how does that intersect with each other on union issues too, for language access. Staff training, these are the different ways that can be included: relevant law, organizational assessment, language access plan, how to communicate with the survivor using an interpreter, or some guidelines, and again, mechanism for training for new staff as they're hired. Part of having language access is community outreach. So how will you notify survivors with LAP of their rights in language access? The signage as well. And it's also inviting cultural civic organizations to meet and discuss services available to them. Going out into the community, driving around and seeing where other communities are at too. We worked with one law enforcement agency in North Carolina that they went by their data, but then they also drove and found 2 mosques in their community eligible service population too, and thought that that's probably an area too where individuals who may be limited English proficient may be as well, and finding out what language they speak. So going out there and finding out where the community is. They may not come to you, but really going to them is important. Churches, hair salons, laundromats, schools, and community centers. If you have money and time, a public service announcement to feature on Culture Civic Radio or ethnic media is really great too. Community informational workshops, legal workshops, know your rights workshops has been great for language access and a way for individuals and groups to distribute the I speak cards to, and letting individuals know that they should be asking for an interpreter when they're going to services, another great way. Now that you've thought about language access and monitor compliance, it doesn't end at just finishing it, implementing it. Again, having to update it is another issue and thought process too. Getting feedback from organizations, community partners. Some organizations have translated a feedback form for different survivors to fill out, so they get a sense of how the interpreter is and how their experience was and how things they can improve. These are some questions to think about as you do your annual review or biannual review of plan. Demographic change, how's your plan affected services? How do you address unexpected languages? Again, making sure that consistency is key. Things to adapt. How are you building capacity in the long term too? You'll find that telephonic interpretation is one piece, but as you continue to grow and as more people seek your services, how are you planning for multilingual staff or spaces where you can have multilingual participation too? Also, how staff hiring and how they're being included into meetings, and if they are also multilingual, how are they able to participate in different settings? One piece too, if there's trainings that your organization does too, how are different individuals with different languages participating in your trainings? And are they bringing their own interpreters and translators? Are you planning to translate your materials? So all those pieces are important to think about as you continue to move on through your language process. So we are at 11:26, and everyone here is almost done. I just want to make time for some final questions before I move on to resources. Are there any more questions for this time?
Yeah, one question just came in. If in Denver, if you know where they can get certified as an interpreter, is that something that ITARC can do?
We can locate and find someone who can provide that information. We'll have to ask a few more questions, like what certification you're looking into in terms of interpretation, and we can find some information about the process of it too. So it'd be great if you could reach out and contact us to get a better sense. We can get a better sense of what you're looking for, and then we can refer you to the right group or agency, and definitely the training that you may need to get certification.
Right, and there was a question about the PowerPoint. We will be sending the PowerPoint within 1 or 2 business days after we end the session today. Well, I think that's all that's coming in. Make sure if you're still typing, go ahead and send that in. But Wendy, is there anything else that you want to add while we're waiting on any potential questions?
Sure, I'll just go a few more of the resources. LEP.gov is a great resource if you're looking for templates, if you're looking for data too, and other resources. They have other memorandums that they've done with courts and law enforcement and other DA, district attorney offices too on language access. This is our email at ITARC right now. It's wlau@api-gbb.org. And here's my number. You're more than welcome to email and contact us at any time. We do language access pretty much 24/7. So we are reachable if you have any questions at all. Casa de Esperanza, the National Latino Network, has a great template on developing your language access plan as well as monitoring it. It's very interactive. If you're looking for translations for different products too or brochures, then the National Immigrant Advocacy Project at American University, they have a law of translation for immigrant legal rights. You can go to Deaf Hope is an organization in the Bay Area that has a lot of great videos on learning about deaf culture and working with deaf and hard of hearing individuals if you're interested. And again, the link here for the Fair Institute of Justice Center and Victimization has a lot of great tip sheets and materials on planning for accessible events and ensuring access for people with disabilities and deaf people too. So those are just some of the resources that we provide. Again, if you have any further questions, feel free to contact us too. But thank you so much for the opportunity today to present, and that's all from me.
And Wendy, one more question did come in. So
Sure.
Someone said, in my experience, I have struggled to find interpretation services for Navajo. Do you know of any services that can provide interpretation for native languages?
Yeah, that's often a question we get too, especially we've had a few from New Mexico that have had that same question too. I think, we can talk more about that. I think part of that is really thinking about how the infrastructure is there to think about bringing people in from out of state or developing a way that there's a trusting way in getting telephonic communication there too, if there's better telephonic services too. So it'd be great to hear like what issues run into. Is it because there's a small number in your area that people aren't able to access the phone, people are not as skilled as you liked? So those are some things that I want to know more about too, in order to help you find other services.
Yeah, and then another question came in. We have people in our community who speak Korean. Do you know how we can assist them?
Could you spell Korean for me?
Yeah, C-O-R-I-N.
C-O-R-N. I will look it up. If you're looking to provide interpretation, we can start. We can definitely contact our consultant and see if they know somebody. I would also, again, want to know what services they are seeking and what what services you provide to. If it's sexual assault services, is it medical services or legal services too? So I think that is a longer discussion in terms of what things that you want to look at and what issues are they coming to see you for as well.
Great.
Can I clarify on that one question about Korean? Is that one of the Burmese languages that you're seeing?
Oh, the person who asked the question says yes.
Okay. So definitely for the new Burmese languages too, there are pockets of people who do interpret around the country. So Ohio, Georgia, North Carolina, there are a few pockets too. So part of it is finding out who is there to provide telephonic interpretation, but also screening that too, because many individuals who are currently interpreting, there is no certification for Korean or Korean at this time. So there is this qualified interpretation, or they're getting training on their own. So it's being clear to how that training is. Another piece is, even though they're at different parts of the country, it is a very tight-knit community, as many Burmese communities and refugee communities are too. They may already know the person on the line. So being sure too that there is a conflicts check with the interpreter and the people that you're serving as well. But one contact is Asian Services in Action in Ohio that I know they have a few career interpreters. I would call and ask how they are on the phone and the skill level they've had in training though.
Great. So I think that's all the questions that have come in. People have been saying thank you very much, and we also say thank you. Excellent webinar for folks to get to know a little bit more about language access. So thank you again very much, Wendy. Any questions that were not answered, please reach out to the presenter with any of those questions in that email address that was given or that is on the slide, and they will follow up. Wendy will follow up. If you have any questions, technical or what's coming up next, please do not hesitate to reach out to CICASA. Look out for a follow-up email containing the copies of the materials. And remember that next week will be the second part of this series with Ana Paula Nogues Mercado. And it's going to be working with interpreters and translators, and that's Wednesday, October 24th at 11 a.m. So we hope to see you there. If you haven't registered, please do so. And then at the end, I just want to remind you to fill out that survey, and thank you all for attending the webinar. Thank you again, Wendy.
Thank you very much. Have a great day.